Just let's do the admin stuff first. The meeting this evening will be live streamed to the public, and a recording will be available on the council's website in 24 hours. Please remember to switch your microphone off when speaking, microphone on when speaking and off when finished. Speak directly into the microphone. If remote participants can use the hands up button to indicate you have a question or comment. And if you are joining remotely, please turn your cameras on when speaking and off when finished. Please switch off mobile phones or place in silent mode. Okay. Apologies for absence.
Yes, Chair. Apologies from councillors Agbley and Petts.
Thank you. Minutes of the last meeting, 27th of October 2022. I hope everyone's had a chance to read those. And they're okay? Okay, thank you. Any disclosures of interest?
None that I'm aware of, Chair.
Thank you. Any urgent business?
Again, none, Chair.
References from committees or other bodies?
None.
I have nothing to report on, so which I guess takes us on to the first item, item 7, the refresh of Luton's sport and physical activity strategy. Who's okay? If you want to introduce yourself and.
Yes, thank you, Chair. Good evening, everyone. My name is Matthew Hudson. I'm Public Health Principal here at Luton Borough Council, and I'll be delivering a report on the refresh of the sport and physical activity strategy. So obviously take the report as read, but just to go through some of the key points within the report in the strategy document. So obviously this is a refresh of the sport and physical activity strategy we have for Luton. It goes into some detail around the health benefits that we have with physical activity. So just broadly speaking, we know it can prevent and manage over 20 chronic conditions and can also support people with enhancing their mental well-being. Of particular note for Luton, some of the key areas where physical activity can have a real impact is around reducing all-cause mortality. We know physical activity can support that by up to 30%, cardiovascular disease by 35%, type 2 diabetes by 40%. It can help reduce social isolation, can have a positive impact on antisocial behaviour. It can support in the reduction of dementia and depression by up to 30%, and also can help with the reduction of hip fractures by up to 68%. So it can have a real great impact from a physical health perspective, as well as the mental well-being element to that as well. So in terms of being able to achieve those health benefits, the chief medical officers have put out guidance around how much physical activity is required to start to realise those health benefits. And broadly speaking, for adults, that's at least 150 minutes a week of physical activity. So enough to make you breathless, but not enough so you can't maintain a conversation. That's a little bit higher for 0 to 5-year-olds. So we're looking at about 180 minutes a day. And then for our 5 to 18-year-olds, that's at least 60 minutes a day. Broadly speaking, in Luton, we perform not very well against the national average in this circumstance. So we're significantly worse than the national average on those who are inactive. So those who are physically inactive do less than 30 minutes of physical activity per week, and in which case for Luton we're over 30% of inactive. And for those who achieve the physical activity guideline, again, we are significantly worse than the national average. However, when we look to contextualise that data, it does kind of show a bit more of a promising and understanding position of why we are where we are. So it does present a significant challenge for Luton, but it's not a unique one in the broader sense of other areas do face the same challenges as we do. So we do compare similarly when we look at the statistical element to statistical neighbours, so those with similar demographics to ourselves. And nationally, it's recognised that those areas with higher rates of deprivation, a higher percentage of those from lower socioeconomic backgrounds, and those with high percentage of diverse ethnic communities are likely to be more inactive. So the challenge is shared across other areas. In developing the strategy, we've tried to do it within the context of the Luton 2040 vision and also through the population wellbeing strategy and vision. and to try and help achieve and make some inroads into increasing physical activity levels within our population, decreasing sedentary behaviour and physical inactivity, we're looking to adopt a whole systems approach. Broadly speaking, that basically means that we want to develop a shared vision across multiple sectors and systems across Luton, including the health sector, voluntary sector, and many others, such as adult social care, children's social care, education, and look to embed physical activity into those systems as a tool or a driver to help in drive health outcomes. So as an example, for children and young people, we know physical activity is one of the main ways that we can improve their resilience at a young age, meaning they'll be better able and better equipped to deal with stressful situations as they move through puberty and into adulthood. We're looking also as part of the strategy to strengthen community voice. So we really want to generate and create a platform which is an opportunity to provide the community with a platform to let us know their thoughts and also and value their input into the strategy, but also have that opportunity for a two-way communication. So kind of like you said we did kind of approach. But ultimately, the strategy looks to recognise the complexities of influencing physical activity across the life course. We're proposing to deliver this through 4 themes of focused action. One being adopting an active systems subgroup, which will work on primarily engaging with system leaders, educating on the wider benefits of physical activity, and also performing mapping actions as well, so we can identify where the barriers are, where the opportunities are, and who are the enablers to support us in delivering the strategy. We will also have a creating active people subgroup, which will largely focus on getting a better understanding of the needs of local people so we can work within the reality of people's lives, and also enhancing accessibility to physical activity opportunities. We're also looking to generate a environment subgroup, and that will largely focus on protecting and enhancing the current sporting and physical activity infrastructure we have in Luton, but equally looking at how we can influence the built infrastructure with new developments as they occur around Luton, as well as contributing to the active travel agenda within the council. We're also looking to develop an active society subgroup, which will largely focus more on the workforce and driving the economy through providing more opportunities for people to get into physical activity from an employment perspective, but also considering player pathways from recreational activity all the way up to professional participation in sport, as well as looking at our communications and marketing engagement with the community. So just to finish off, we have also included a timeline in there. So we are looking to go out to public consultation imminently on the strategy, but equally we would also welcome any views or comments on the draft strategy as it is at this moment in time. So thank you for your time, and open for any questions or comments, please.
Thank you. Just to say that we have been asked to note and comment on the report and note and comment on the timeline and draft strategy. Does anyone have any questions or comments? Yes.
Hello. Thanks for the great report. I'm actually a dietitian is my day job, so seeing something like this is really good. I like the active systems, active environment, that sort of thing. I know there are some bits about it on the report, but are we going to have a bit of focus on, because you know people from Black and Asian minority ethnic backgrounds are less active, especially children from those. Are we going to be focusing, is there any sort of focus on that, and how we can engage those communities a little bit more? And the other thing is, which is you're definitely already working on, but Luton is not very walkable. In places like, for example, like Cambridge, you know, there's loads of cycle paths, there's loads of walkable paths. It's just not like that here, and I feel like that's something we really need to work on to get people to be a bit more active, generally, just going for walks and that sort of thing. The other thing is safety. Women, and not just women, generally people don't feel safe to walk around Luton in some areas, even in the town centre. So yeah, that's just my comments, but I'm sure you already have considered all of that. Thank you.
No, thank you very much for the comments there. It's very nice to hear that. It's sort of going on in the right direction. So I really appreciate the positive comments we've got there. Certainly inequalities and inequity is something that we will focus on within the strategy, and particularly through public health and Marmot Town, we'll be following those recommendations as well quite firmly through the delivery of this strategy and how we can use what's broadly termed as universal proportionalism, so using that targeted focus on our activity, so ensuring those population groups are identified as being less likely to be active, that we're actually providing services more towards them. But equally, I think probably one of the key things that we're hoping to get through the strategy is a better understanding of how we can meet the needs of those community groups as well. And hopefully through that process, like I say, through providing that community voice, we'll be able to empower the community to, rather than be too prescriptive and dropping interventions in, that we can empower and provide opportunities for the community to provide things for themselves from a physical activity perspective. And yeah, certainly take your notes on the environment, and that would be a key focus of the environmental subgroups. I'll reaffirm that within our documents as we move forward. So thank you.
Yes, Councillor Campbell.
Thank you, Chair. Now, you said you're going out to consultation. How are you? A bit of an echo, yeah? How are you going to, and where are you doing this consultation?
Thank you, Councillor. So with the consultation, we're doing it through kind of a multifaceted approach, really. So from a basic perspective, we'll have a survey which will be available electronically as well as physically, which people could complete within their own time. But we'll also be attending a number of different community groups and locations. So for one example would be attending Luton Irish Forum. We're also attending the Department of Education funded Parent Carer Forum in terms of EPIC, as well as loads of other different community groups. But we'll also be basing ourselves in different locations throughout the course of the consultation, such as leisure centres, but equally also non-traditional locations for physical activity, such as community centres. We're also looking to engage more broadly with the with faith groups as well, to provide opportunities for us to extend our reach as far as possible. So we're open to anything and everything, really, to ensure that we give people the best opportunity to respond. And it's still a developing programme, but I'm more than happy to provide a full comprehensive list of all the locations we'll be going back to the group, if that would be useful.
Yes. Go ahead.
Will you be advertising this in the doctors' surgeries and places like that?
Yes, so we're hoping to get on the screens within GP surgeries, as well as other digital screens and opportunities around Luton. So we'll definitely be advertising within GP practices.
Yep. Sorry.
Okay.
In draft for consultation, you've got building an inclusive economy. What do you mean by that?
So within there, one of the previous kind of terms we were using around Luton 2040 was around supporting an inclusive economy across Luton. So broadly speaking, from the physical activities perspective, we'll deliver against that through work that focuses on the workforce, as well as looking to improve the health and well-being of the population, to ensure that more people are able to either not engage with social care at an earlier age. So in terms of falls prevention, as an example, hopefully we can extend periods of what we term as quality or disability adjusted life years, so people living longer without need of care or support and more living independently. So there's multiple assets on how we can contribute towards the economy as part of the strategy.
Thank you. Councillor Moore?
I was just going to say, it'd be quite nice to get that list, because obviously you can consult in leisure centres, all the places like that, as much as you want, but they're the people that have been active in the first place, as a general rule.
And yeah, I think to add to that as well, so thank you, Councillor, is that, and any comments or suggestions that could come back from anybody on other groups and forums where we could attend would be greatly and well received. As you say, the risk of just going to the usual areas is that we get the usual suspects that would respond to such a survey, so we need to try and engage those that aren't probably converted at that moment to being physically active. So yeah, appreciate the comment, that's a challenge.
Councillor Akbar.
Can you actually elaborate on the whole system approach? You mentioned in the report, that's in the appendix, young people, children, adults, older people. So how actually can you define this? How you will actually deliver this, or how to approach this whole system approach?
Yeah, thank you, Councillor. Yes, absolutely. I can give an example, hopefully, which will bring it to life a little bit more. So as a pilot exercise, we worked with Active Luton, our leisure provider, and Sport England, the national body for sport and recreation. And what we looked to do as a whole systems approach was look at children who are on the edge of care. And so we brought system leaders together in a workshop to explore where opportunities and what factors were influencing children, or gave us touch points to engage with those children and young people who were being looked after by the council to provide opportunities for them to be more active. So through that process, we were able to identify through the council's corporate parenting and responsibilities an opportunity to provide an enhanced offer to care leavers. And so as part of that process, we were then able to develop a new network, which was essentially knowing who to speak to. So the right people, putting the right faces, the right names, and the right job roles together. And we're able then to provide care leavers with 12 months of free physical activity at any Active Luton facility. That was then reviewed by the Department of Education, and they said you could make it slightly better if you enabled them to bring a friend. So thankfully, there was enough money within the system and enough will and want that we were then able to do it on a bring a friend scheme as well. So care leavers of Luton Borough Council are able to access 12 months of free physical activity for Active Luton and to bring a friend. And that was brought about through a whole systems approach, because we're able to engage with those system leaders from the children's side of the services within the council. We're able to agree on the importance of physical activity, and then we're able to bring it through as part of the council's corporate parenting responsibility as a touch point, which they could then offer free physical activity. And just to add a bit more of the personal element to that, one of the care leavers who we spoke to, it's a quote that still lives very strongly in my mind. She said, "You wouldn't have to pay for my care sessions if you brought me new hockey kit." So it's just, again, one example of how we're able to utilise that systems approach, get a better understanding of needs, and communicate that to system leaders to influence those pathways and how physical activity can play an important role in those young people's lives. So I hope that's given a kind of a bit of a context to how it actually functions. But essentially, it is just around bringing different systems together or different areas together who may not traditionally consider physical activity as an option to delivering their outcomes and showing the wider benefits, such as I referred to developing resilience in children and young people, and how physical activity can drive a role there, how it can help drive the economy through more activity in terms of getting people into work and into jobs through developing confidence and motivation, as well as actually working within the physical activity sector. And we know that those children who are more physically active tend to perform better in terms of academic attainment as well. So there's lots of wider benefits which need to be communicated through different systems, and we can explore how we can work in other ways. So we're currently looking at, as a next step, older adults and what more we can do within that system to help prevent people moving along the frailty index, from preventing them from getting severe and holding them back in the mild and moderate areas, so they don't sort of come on to being severely frail. So is a challenge, but hopefully that's given some context. But I'll stop talking there.
Two questions, Chair. I know it's the hard work and it needs resources as well. What about that resources? Sufficient or to actually implement this strategy?
So resources is a challenging one. Obviously, a lot of our resources from a public health perspective go into healthcare provision, and it's around how we can best influence systems and to enable more resource to flow into physical activity and the development of achieving health outcomes. So although there isn't a significant resource, it's the officer time primarily behind it. We do obviously have Active Luton as a key partner and stakeholder within this through public health, and the ICB, we commission the Total Wellbeing Service as well, which has an invested interest in ensuring that people are more active. And just generally, as I say, it's more around getting people to understand that physical activity is everybody's business. So investment at all levels would be beneficial across the life course. So it's trying to unlock resource where it exists, such as the example with those children who are in the care system or on the edge of care within Luton. It was actually through sort of working with the virtual school, opportunities through Children in Need money, etc., where we're able to unlock other doors. Active Luton now provide a guaranteed interview scheme for care leavers as well. So there's multiple different ways in which we can do it without necessarily having significant investment. It's around sort of working on those pathways and enhancing them to the best of our ability.
Councillor Moore.
This possibly a little bit of an aside from just the report on the timeline of the consultation and who involved in the consultation itself. I'd just personally be interested in finding out what, and when yourselves asking as part of the consultation, what your partners with Cricket East are doing, basically in terms of disabled cricket in the town and the county, because you think about improving people's physical activity through sport. I would say the town itself, cricket would be one of the high-level sports, and people with disability, and as someone who's played disability cricket at the highest level, I had to play disabled cricket for Hertfordshire because there simply wasn't anything in Bedfordshire. Now, maybe part of that is my dad also played his normal able-bodied cricket in Hertfordshire as well, and I got in the system that way, but there wasn't anything in Bedfordshire at the time. And I've just been researching, and I still can't see any relationship to a Bedfordshire disability cricket team at all. So it might be something for you guys to have a word with Cricket East in terms of what you're doing within that realm of thought, because obviously we talk about getting kids, obviously that's a big thing, but also getting, I think disabled people think that a lot of them, that they're not, that being active, sport's not for them, and you see at all levels with the Paralympics and things, that's not true. But if we're not offering it in sports, because some people don't like sports in the Paralympics, if you're not offering it, it's not there. They can't go out and do it.
Thank you, Councillor. That's a very important point, and it's a key focus for us as part of the strategy, and one of the key areas that we'll be focused on as our work progresses. I'll certainly take an action on speaking with Cricket East around what they're doing, and if we can hopefully speed something along, and we'll come back to you with any information I gain from that. But no, I appreciate that point. Thank you.
Councillor Campbell.
Yeah, well, are we talking about cricket?
In sport in general.
Yeah, because I have played cricket in this town from 1972. I'm also now the president of my cricket club, and cricket is a very active sport in this town. The only problem I have with the town is we've got to stop building on green belt so that we have more green belts so people can be more active. Now, we have three teams. We have a youth team, we have a second team and a first team, and we're also having a ladies team as well, because Cricket East and East of England Cricket Board was throw a lot of money into once we have children and girls playing cricket. So there's a lot to be gained if we can encourage girls, youngsters to play cricket. The problem we're having is a lot of youngsters don't want to play. They will either go and play a game of football which lasts about 90 minutes and then they can go and do something else, whereas cricket can go on all day. But as I say, I have played cricket in this town and I've noticed that we're losing a lot of the sports ground. They built on Lothian Road cricket ground, a swimming pool. It's a cricket ground that I used to play on. And I am disgusted with it. Thank you.
I would just say, obviously, the Environment Subgroup will have that key responsibility of ensuring that we protect and enhance what we have as best to our ability. So absolutely, I'd agree with you that we need to maintain the sporting infrastructure we have available to us and look to enhance it as best we can, as playing pitches is a key issue as well that we discuss. And a strategy that will sit underneath this one is the playing pitch strategy, which is currently being refreshed, which will highlight those issues and has been consulted on with the clubs across Luton. So we'll have a key list of recommendations coming from that very soon, and I can bring that here for discussion if that would be useful.
Yes, thank you. As well as the list of locations where consultations are available, could we also have a list of the questions in the consultation? Would that be possible?
Yes, Chair, not a problem. I'll share the draft survey that we've developed, no problem.
Thank you. So, talking about the questionnaires, so there are questionnaires for children and for adults, but no questions specifically targeted at older adults or for the SEND community. Is that correct?
So at the moment, we will be targeting the SEND community through the questionnaires, but mainly through kind of forums and meeting with sort of like the Family United Network. And as I said, with EPIC, we'll be looking to meet with them in person. We're currently in discussion around developing an easy read version of the strategy, which we can then use with those communities to ensure there's a clear understanding of what we're looking to achieve. There will also be a survey which will target organisations as well. So there's kind of a generalised adult survey, children's one, and then there'll be a organisational one as well. But we'll be, from a SEND perspective, be looking to engage more directly rather than through the survey with those groups where possible.
Okay. So it's obviously a strategy for physical activity, but you acknowledge in the strategy that healthy eating and diet is important. Does the survey, does the consultation include information gathering about diets or questions about whether people realise that diet is important?
Not currently, Chair. We haven't done any specific questions focused on sort of diet or nutrition within this survey currently. But another stream or remit of work within my portfolio is the healthy weight and obesity work that we do in Luton, and we're developing a portfolio of work for that at the moment, which we'll also look at potentially developing a food strategy for Luton, which will come into some more detail on the nutritional profiling and things across Luton, as well as hopefully bringing in some policies around advertising of foods high in fat, sugar and salt, but that's kind of in the ether and in development. So again, would be really pleased to bring that here for discussion.
Yes, that'd be good. Thank you. Would it be an idea to have more information in the strategy about how the voluntary sector will be involved, or perhaps you could tell us how the voluntary sector and community groups will be involved in the strategy?
Okay. To date, we haven't had too much engagement with the voluntary and community sector as yet. We've engaged with sort of key stakeholders such as the Active Partnership, Active Luton, the Luton Town Football Community Trust, Cricket East, and sort of many sort of larger organisations to kind of develop the draft approach that we now have in terms of a whole systems one. So the next step for us as part of this consultation is engaging more with the community and voluntary sector around their thoughts and opinions, and if there's any amendments or concerns they have with what's currently being developed. So we're, as in the report, we're looking to do a two-phase consultation. One is this initial phase around gathering more views of a wider net of engagement and developing some communication links and channels. Through this process, we'll then look to develop a final draft strategy, which will then go out to further consultation on at that point to ensure that we've captured everyone's views appropriately.
Thank you. So phase 2 of the consultation will be going out to the same group, same locations, so it's it's aimed at all the residents of Luton. Okay.
Yes, Chair. We'll be looking to anyone who we engage with, communicate back out directly to them if they provide us with the details to do so. But we will re-engage with all those groups, and hopefully more that we will develop through the course of the phase 1 consultation.
Okay. I think just one more thing. The impact report that you mentioned on page 32 of the strategy. What sort of information will be in that report? So I'm guessing it's going to be a lot of information about how the key measures are being reported. I mean, so for example, will there be numbers in there? Will there be what sort of measures of success will be reported?
Thank you, Chair. So with the impact report, what we're hoping to do is a mixture of both the quantitative side, so as you say, kind of the facts and the figures and the numbers, and obviously we largely get information through Sport England in terms of their annual survey, but we'll also be looking to enrich that locally with data that we get both from the primary care network, so those who are going through, such as from a falls perspective, as well as looking to do more localised surveys, such as the school survey that we send out, the shoe survey, and where we get student views and numbers around those that are engaging with sport and physical activity. And we'll look to enrich that as well with the qualitative side, so the sort of the case studies, the individual stories of individuals and how it's had an impact on them. And kind of more broadly, any specific projects that we do, there'll be details on what we did and why we did it, but there'll hopefully be opportunity for evaluation to be as part of that process as well, where we can show what's worked, what hasn't worked, what the challenges are. And as part of that process, we're also hoping to hold an annual engagement event where we'll do more of a presentation and communicate the impact report, as well as providing another forum and opportunity to hear back from the community.
Okay, thank you. Does anyone else have any more questions or comments? Okay. Okay, so thank you very much. What's a very detailed report. A lot of thoughts and a lot of hard work's gone into it. So, look forward to the results, seeing the results of the consultations. Thank you very much.
Thank you, Chair. Thank you, everybody.
Okay, on to the next item. Item 8, primary care access in Luton.
Hello, Chair.
Hello, Nikki. Thank you.
So we have this as a standing item. So if I just take you through the paper, we have some obviously ongoing work. So if I just home in on the two elements that I think members were particularly concerned about was the ability to have pre-bookable appointments and for appointments on the day, i.e. that they're feeling unwell and they want to have an urgent same day. So the report emphasises there are a great deal of appointments, and we as previous months we've given you the numbers, so 98,000 appointments in September, 94 in August, and 96. But the appointments is only a small part. The reason we put those in again is just to give the when I say the amount, obviously the GP practice workforce are seeing to those patients, but the paper, hopefully you can read through. We're talking about the fuller programme, and just in case anyone's new to the meeting, the fuller stocktake report was published in May, and we have mentioned it previously in the context of the 4 pillars. And particularly for this report, it is this providing streamlined and flexible access to same day. But the reason I emphasise about the pre-bookable, that is very much where people are wanting personalised care for perhaps long-term conditions. If people want to have, book their maybe a diabetic check or a hypertensive check, so they want to have appointments that are pre-bookable. So the work has continued to work some bespoke support to any of the 27 practices, what we call are most significantly challenged. And it does tend to change month by month, and often it will be about workforce. I can go into a bit more detail because there's a great deal of work taking place. We've got a clinical lead supporting our 6 primary care network clinical directors, specifically on access, and it's a Dr. Monjour Ahmed, who I know has done quite a lot of work. I think with anyone from Healthwatch this evening, I think he attended the AGM, but equally he's doing some educational sort of webinar sections, because we have got some practices that are doing amazingly, and it's to try and identify those good practice so that everyone can work in the most efficient way. So the mantra of it is the right time, the right person, the right place. And this is in Luton. In fairness, Luton is slightly better than some of the other areas in Bedfordshire, Milton Keynes, because they're really making better use of our community pharmacists, which are an amazing asset to support primary care. With the evidence, we know that there's some patients that we call it lower acuity, but it's basically needs of patients that can be addressed admirably well by community pharmacists. So we've given you some details on what we call the GP community pharmacy consultation service. But in particular, I wanted to raise, because it's new for this month, we've tried to get a transparent and informative approach, so we can really share with any stakeholders, but particularly with our residents, about what the offer is of primary medical services. So hopefully you've got that as an appendix to the paper. It's dynamic, it's live. The first one may seem a bit long, 8 pages, but in particular, that's where we'd really value your response and feedback on that. And particularly, I think it was, I'm just trying to think which month it was. I think it was August, that one of the recommendations from a member here was that we needed better communication. So this is just one area. So I'm going to pause there and take any questions.
Thank you. Does anyone have any questions? Councillor Campbell.
Thank you. Now, the 16th of November, I found my GP surgery. Could not get an appointment. So I found 111, spoke to them. They got back to me, talked to me about my situation, got in touch with the surgery to try and get me an appointment. And they reckon 2 days I should at least have an appointment. The 21st of this month, I found the surgery, nothing. This is one of the problems we're having. Eventually, I got an appointment for 20 to 5 on yesterday, Tuesday. I actually spoke to the surgery the doctor who owns the surgery, he was in there, and we had a long conversation as well about this. And the problem is that if 111 got in touch with the surgery to get me an appointment, and that was on the 16th of November, and the 21st of November, nothing. I just think we're going totally and utterly backward. We're not getting the service anymore.
So could you just clarify? So when you said just so I'm clear about where I can help, is that when you phoned the 111 because you couldn't get through to the GP practice, had they promised that they would get, what was their promise to you, I should say?
I found a surgery in the morning to try and get an appointment, and there was none. So I phoned 111 because I was concerned, and they got a doctor to talk to me and then got in touch with the surgery because they thought I needed an appointment. And that was on the 16th of November. And on the 21st of November, I phoned the surgery to find out what was going on. And they still hadn't done anything. It was in the system and they just couldn't be bothered.
So I can pick this up. So it was the practice that hadn't picked up the communication from the 111?
No, the communication was in the surgery.
All right. So your concern is the surgery, not the trip. I just need to know where I'm homing in on.
Should they not react to the information from 111? Simple as that. On the 16th of November.
Well, I apologise for that. And if you perhaps, because I know you're not email, if you don't mind giving Eunice your the practice name just in confidence, and I can follow that up for you.
I think you got my telephone number, so you could ring me.
Okay. Any other questions?
Hi, Nikki. One from Health Watch. We believe there's still a continued issue with the integration of extended hours contracts. So, like between 111 and the GP and the hospital in their integration of services in extended hours.
So can you, I thought we'd got that quite well supported. So is there anything in particular? So clearly that the general practices, when it's there's an enhanced access service. Are you saying that you can't access those appointments?
I think this is from Lucy, and I think what she's saying is if somebody phones 111 and then they refer them onto the hospital and they say, yep, you can get straight in at the hospital, you don't have to wait, we've made your appointment, and then when the person gets to hospital, that doesn't happen and they have to wait in their time again. Does that make sense?
Yeah, I probably need to pick this up outside because if the 111 service, the patient's clinically triaged and the recommendation is to go to the A&E, there's something called a virtual waiting room, and that the 111 will have informed the A&E department, but they certainly don't make an appointment, but they give an indication. So that's quite clear. But for the extended access, it is an appointment time and that should be working properly. So if it isn't, I need to pick that up.
Thank you. Yeah. Just another one. Lucy's asked, how do we compare with national data? You know, with our appointments and people getting appointments and things like that. How do we compare Luton with nationally?
So we have the annual GP survey, which we talked. I think I brought that in the summer, and that was, I think, with Councillor Appleby, I was saying that Luton experience of patients is not as good as it should be. It's at the lower end, hence the reason we're doing this targeted work. But I do stress again that, and this is why I do encourage people to just give consideration what I call our BLMK Fuller programme, because the Fuller programme, it was a stock take undertaken nationally, but it really does indicate that if we get our care offer to the population with complex frailty, for example, which is very much, and I know we've been doing a lot of that work in Luton over the last few years, about a really personalised, integrated team between Cambridge Community Services, who are the provider for community, East London Foundation, Just the Mental Health, and again with the community voluntary sector with GPs. So if we get a really personalised, proactive offer, it does free up appointment times and appointments for people wanting same day. So what we are in our plan and what we're working to is to try and give a bit of segregation to people who don't have long-term conditions or infrequently use our services. We know that they don't mind where they get that treatment. So that's why our community pharmacists, the urgent treatment centres, there are other offers. And that it picks up the point that you just said in about making sure it's all integrated. So I think that's probably the most important part. But ultimately, what we need to do is we need to get the GPs working as part of our Luton Place teams, and it is a realisation that it isn't the GP as the only clinician that people need to see, and I don't, councillor who was saying your problems with your practice. It could have been another clinician. It possibly, I don't know your personal details, but it could have been somebody within the practice or even the community pharmacist. And that's why we've got to go, we've got to get right, what we say, right time, right place and first time. But I can easily pick those individual issues up because that's the only way we learn. And the only other thing I was going to say is, and this is to the chair, if you would like our clinician leading our access work, if you want a very focused clinical session, we're very happy to do that as well at a future meeting.
Yes, that would be good. Yes, thank you. Councillor Ali.
Hello, thank you for your report. It's very well detailed. This primary care access bulletin sort of leaflet thing, it's really good. Like seeing that actually 80% of patients are getting face-to-face appointments when we kind of feel like they're not. 57 are being seen by people that aren't GPs, which is good because we don't have enough GPs, but we also don't have enough pharmacists and nurses anyway. Where is this going to be circulated? Where's it going to go? It would be good for people to actually see this information.
So it's on the website, and we were going to literally produce this every month. Of course, as I said to you a moment ago, very, very happy to take any modifications month on month. But any forums that you recommend that we use, we will. So that's very much colleagues on this call. So as I say, the website, it will go through onto the council's website as well, clearly to health and wellbeing board members. So any forums we're aware of.
So in terms of it going out to the general, because obviously if it's on the site, you have to actually really search for it to see it. Is there any way we can put it on, I don't know, post a link to it on social media or things so actually the public can see it, rather than, because not many people are going to go out seeking it. Of course, it's good for the councillors to have it and that sort of thing, but it would be good for the actual population of Luton to be able to read it.
And forgive me, that's exactly, so our comms team are doing the proactive. Yeah, so it will be, and this is the first time you'll have seen this. So if people are happy with it, exactly, social media, any, I'm not as au fait, but our comms team will be. So if there's any forums that, or any other routes that you think it should go to, and plus the fact, if you can see whether or not when they do post it out, whether there is any response to it, again, if we could keep that local intelligence and that feedback loop, it will be fantastic.
Sorry, I don't know if this will be opening a can of worms, but maybe if you had like something at the end that said any comments, or like a QR code where someone can put bits in. I don't know if that would be a bit too much, but that might be useful because then the public can say if they found it useful or not.
I will take that one back and give some thought to it. As you say, we don't want to raise expectations by not being able to respond if people are. But yeah, totally. If we can put some, we need that feedback loop to make it meaningful, don't we?
Thank you. And following up on that, Nikki, residents who don't have access to the internet or have difficulty accessing the internet, would it be a good idea for members to get in touch with yourself about getting hard copies posted in various locations, libraries, that sort of thing?
So that is certainly the plan. So what I will do is, with our communications team, I will circulate what I call a summary page of all the various routes, but I definitely know some hard copies in some key places was an expectation of it.
Excellent, thank you. Anyone else? Any more questions? I've just got one more. The bulletin talks about triage and total triage. What about the stage before that? I mean, it seems to be before people get to that triage, where a lot of the where people are encountering a lot of difficulties in actually getting to that triage stage. So when you're ringing up your GP, the telephony systems can't cope with the number of calls, and people are waiting for X number of minutes, and they're six in the queue. So how's the telephony systems of the PCNs and the GP practices developing?
Yeah, so that is one of our work streams, and there is a plan for all the practices to move on to what we call cloud-based telephony. Because you're absolutely, if you can't get the telephone answered, then you can't start on the process of working through. I think our Luton practices are. I think since the last meeting, I don't think we've got any practice now that hasn't got a waiting facility. And I know, Chair, what you just said is that if you know you're sixth in the queue, at this moment in time with this new telephony, is that's the speed of the phones being answered is as much about the staff being able to, is staff capacity. I think the important thing we were trying to put in this leaflet is there was a bit of reluctance for some patients, residents, to be giving information to somebody who they was thinking, wasn't clinical. So it was really explaining that the total triage is that staff who do this are fully trained, similarly in the same way as the 111, what we call the call handlers. But did you have a particular issue to any practice on telephony?
There is, yes. It was one particular practice which I can't recall off the top of my head, but I can get that information to you. So I think we've spoken about this before, and you've spoken to this group about this before, about the differences between practices in their quality and timeliness of responses.
It's one of those really tricky ones because primary medical practices are responsible for their own telephony. By contrast, they're not responsible for their GPIT systems, the computer systems. They are provided centrally. So we, the Integrated Care Board, have to make sure that all practices have fit for purpose computers. What we have done with the support of the regional team, where there was some funding, was to, you could say, speed up practices using better telephony. So there was an opportunity to bid for money. So we have done that successfully. It's a complete priority of the Integrated Care Board to get telephony. And believe me, myself and others have been pushing. And that's why we've got a plan for all the practices to have improved telephony, within the constraints. We've prioritised that. There's always constraint budgets, but we've prioritised that of telephony. So if there's a particular practice in Luton that you're aware of, my understanding is that there's still some improvements on some of the systems, but there isn't any that don't have any facility where you know where you are in the queue, and that you no longer just get cut off if you're waiting too long.
Okay. Talking about telephony, you can have the best telephony system in the world, but is there still going to be a bottleneck caused by the number of staff responding to doing the triage and responding to telephone calls? Is that just high quality telephony system? Is that just shifting the bottleneck a bit further down the line?
So they need to go hand in glove. You're absolutely right. You can have the best telephony systems, but if you haven't got the staff answering, and part of what we're doing within this programme that was in the paper is really about sharing that best practice, and it's about modelling the number of calls you have and putting sufficient staff to answer the calls. But in the communications, we're equally saying about there are real if you look at the telephone calls into a practice during the hours they're open, 8 in the morning till 6:30, it really is, 8:30 to 9:30 is a massive bulge. So, for example, it is us working in partnership with the people using the service, residents and patients, to try and even the service throughout the day. So that was where I started with getting the modelling right in practices for some of their pre-bookable appointments, because some of our practice staff have saying some patients have been anxious about not getting an appointment, so they would try ringing just in case they need an appointment in the next couple of weeks. So that's not helpful for the patient at all, and it certainly doesn't help the system. So it is about trying to get that modelling right. And the staff available to answer the calls, but working with the patient groups. And I know, well, I think we've spoken here about the value of the patient participation groups. So that's another work stream in the sense of it's basically how do we all work with the primary care practices to get the best out, and they've got so many staff, and how do we use those staff numbers. And I think the other big bit, which is in these, and I'm just looking to which page it is. I think, in fact, it tells you about the different roles. So it is, I know colleague has just said that there isn't enough pharmacists. All workforce is harsh. In fact, it's page 6. It talks about nurse practitioners, pharmacists, mental health practitioners, social prescribing, and paramedics. So there are a whole group of other staff members other than GPs. And that is exactly part of this work, is how we're increasing the capacity of workforce. And I think you may remember I was saying through the primary care network developments, there are further funded staff. And again, I can do for the next meeting to show you the increase in staff numbers. So it hopefully gives you that assurance that there is someone, once the telephone's answered, that there is staff behind that to act upon the patient's needs.
Yes, that'd be good. Thank you. Any more questions? If not, thanks very much, Nikki.
Okay.
Thank you. We move on to item 9, sickle cell disease situation in Sally.
Thank you. Apologies, I'm just making sure I've got the paper up. Did everybody receive the paper? It did come out late. Yeah. Great. So paper is particularly in response to a query from Councillor Agbley. So it's a shame that he's not here, but I can follow up with him outside the meeting if needed. So it was just a request for some data around the position on sickle cell disease in Luton and treatment that's available, particularly thinking about the inequalities element. So just as background, sickle cell disease is an inherited condition that affects red blood cells, and it's particularly common in people from African or Caribbean family background. It's a genetic disease that affects how red blood cells develop. And if parents have the gene, there's 1 in 4 chance that the child is born with sickle cell disease. But you can also be a carrier. So if you're a carrier of that gene, then you're known as having sickle cell trait and not having the disease itself. So that's important because the data that showed in the report, most of it covers both sickle cell trait and disease numbers of cases. So I'll pull that out as I talk through the report. So the first table just shows the numbers of patients in Luton and then gives a rate per 1,000, and that compares to the other 3 boroughs in BLMK. And that is sickle cell trait and disease. And of that, for 1,492 in Luton, just over 1,000 are trait carriers rather than actually having the disease. So there's about 400 people in Luton that have sickle cell disease. And then for the rest of the figures and graphs, it's both trait and disease, but you can assume that it's sort of proportionately, the pattern would still follow. So the next figure shows by practice, and you can see that the largest number of patients are in the Vale Medical Group practice across Luton, and the numbers vary across the practices in Luton. The next graph shows by gender, and you can see that in all boroughs, including Luton, there are more females than males with sickle cell trait or disease. And then looking at ethnicity, again, as you would expect, the pattern is that the highest number of patients are in the Black ethnic group for all boroughs, including Luton. And that pattern is the same across all of the boroughs. And for the other groups in the boroughs, there's a bit of variation, but nothing particularly of note. And then the last figure just shows the breakdown by age. And you can see across all the boroughs that the largest number of patients with either trait or disease are in the 0 to 18 group. And then there's just a few points around the services that are available for sickle cell. There is a national screening programme, so antenatally and in newborn, there is screening for sickle cell trait. So the screening in pregnancy and then the newborn blood spot heel prick tests for sickle cell as well. Patients are managed at Luton Dunstable Hospital, but there is a choice of wider providers in the area as well. It's provided by the haematology department with links to wider specialties, and is part of a wider network across the east of England and north central London with specialist centres in London, in UCLH. And if patients require red blood cell exchange transfusions, they also then go to London at UCLH. So I'll stop there and open up to any questions, but I will sort of a bit of a caveat on the questions that this isn't an area of my particular expertise, but I've pulled together data from the ICB around the numbers in practices and the services available. So if Nikki's still on the call between us, we hopefully will be able to field any questions or take them away and get some further information.
Does anyone have any questions? Councillor Campbell.
Thank you, Chair. Back in the 70s and 80s, there was a family in Sandon Park who was trying to get awareness to sickle cell in the town. I was involved in it a bit, and my actual children has been tested for sickle cell. So it's nothing new, and it's a shame that this is probably the first time. If it wasn't for David bringing it up, it would not have come to this committee. But it's, as I said, the family in Ilrise, they had a sickle cell association type people who were trying to raise awareness back in the 70s regarding sickle cell. It is a thing that even Mediterranean people suffers with it, not just Caribbean people. So it's a bit bigger than we think. But I mean, and the worst thing is where they have to go and have transfusion, and it can be bad. But as I said, my family had all the tests for sickle cell.
Thank you. I haven't got in the report, which I can try and look into further if it's helpful, is around the uptake of screening, antenatal newborn screening, by ethnicity, because if there isn't high uptake of screening, then there may be something we can do around promoting that, so people do take up that offer and understand the risks, and that there is something that can be done about it if they're identified as positive. So that's something I can look into a bit more.
Thank you. Yeah, I think that's a good point. It'd be good to have that reassurance that the screening programs for sickle cell are comprehensive and thorough. I just have a couple of questions. One on behalf of Councillor Petts, who wanted to know, is there a gene therapy treatment on offer for patients in the B&K area?
I'm not sure what you mean by gene therapy. You don't mean genetic counselling, you mean for those that are identified as positive?
So that's a good point. So I'm asking this on behalf of Councillor Petts, so presumably
Okay.
he would know more.
I can follow up outside of the meeting, I'm not sure, to be honest.
Okay. So the other question is, are patients, are they informed about the Sickle Cell Society?
Again, I can take that away. Nikki's got her hand up actually on the screen, so I'm not sure if she had anything to add.
The only thing I, having been a midwife, I'm not a practicing midwife, but I can confirm that all newborn babies are offered a blood spot screening test. Ideally, that's done at 5 days, so I can give you that assurance for any babies born in this country. What we can check, Sally, is I'm pretty certain that there's a routine blood test in pregnancy, so that, you know, if you're at risk as the mother.
Yeah, there is. So there's antenatal and newborn screening. So there's that conversation there, and there will be genetic counselling as part of that. So what we can take away is looking at the uptake of that in a bit more detail in Luton.
Yeah, I'm pretty certain it's just a routine test. I can honestly say, but we can double check. But I would be very surprised if it's not as a routine, because there is another test, the Guthrie test, and they are done together. So, but we can check that with the midwifery teams.
I think that's right, because I'm sure I've seen that mentioned on the national NHS website. Yeah. Okay. Pat?
Not a question, but a statement, because I'm a teacher at Luton Sixth Form. We actually have a link with Sickle Cell Nurse in Luton, who comes in and gives students advice and gives teachers advice on students that we have, mainly Afro-Caribbean students that do come through the college with sickle cell. Yeah.
Okay, any more questions? Okay, thanks very much, Sally. Thank you.
Thanks.
Okay, item 10, draft work programme. I think.
Thank you, Chair. This is members' opportunity to identify on any items coming up on the forward plan that wish to be included on the committee's work programme, or if there are any other items that members would like to be brought up. Councillor Campbell, can see you waving your hand.
I've been trying to get about dentistry in this town because I think they put it in January or something.
Yeah, it's on in January.
But I mean, I really wanted it sooner, but obviously it's not going to happen now. And we need to have a couple of dentists in here so we can grill them.
Yeah, just looking on the work programme, Chair, the next meeting in December is quite busy. Could see if we could. Health and wellbeing. Yes, it is. Sorry, Chair. Just have a look. If we can move that forward, Chair. Yeah, I think that's it, Chair.
Yeah, okay, yeah, so it looks like a pretty full meeting on the 12th of January. And there is a list of potential future items, which I guess as time goes past will slot into the meetings at the beginning of next year. Okay, if that is everything, then I think we can close the meeting. Thank you, everyone. Thank you to all officers reporting this evening, and thank you for attending.